Medical professionals of Reddit, have you ever had a patient so lacking in common sense you wondered how they made it this far? I'm a vet. A few years ago, I had a client bring his young cat in complaining of lethargy. Besides being a bit underweight, the physical exam was unremarkable, so I asked more questions about the cat's diet. Me, what do you feed the cat? Owner, online trendy raw food, brand me. How is his appetite? Does he finish what you feed him? Owner, yes, he always eats everything. Me, how much do you feed him? Owner, 1 cup. Me, once or twice daily? Owner, once every 3 or 4 days? Me, you only feed your cat twice a week? Owner, I believe in a more natural feeding approach, and based on my research, that's how often cats eat in the wild. This owner was slowly starving his cat to death based on some cockamamie idea he'd made up watching National Geographic. I had to explain to him that domestic cats are not tigers, and that small wild cats eat 10, 20 small meals daily. Surprise, surprise, the cat's lethargy and weight improved with regular feeding. Story 2. I'm in the air. So many stories. The one that left me dumbfounded was a woman was brought in by her sister for pelvic cramps, amenorrhea, for 3 months. Lo and behold, she's pregnant. Sister informs me that she sleeps with the Brazilian construction workers building the condo complex next door. I ask if they have any questions. The patient asked me if her baby would come out speaking Spanish. After a long pause and her sister staring at the ceiling, I told her no, because they speak Portuguese in Brazil. Patient seemed relieved, and the sister hustled her out of the air before I could discharge her. Story 3. A rural doc here. 35-year-old female walks in with right-sided jaw, neck swelling. I think it happened because I ate some meat yesterday that my body is reacting to. 10 minutes later. Oh yeah, and I accidentally swallowed a bee and it stung me in my mouth right before this happened. Sorry, I forgot to mention that. Story 4. I used to be a medical oxygen tech, mostly doing in homework. One guy was on such a high concentration that he would have drawn nearly 0 oxygen from breathing regular atmosphere. This required 2 heavy-duty machines hooked up in tandem just to keep him barely alive. This was explained ad nauseum to him and his wife, with full signed documentation of every conversation. They'd shut one machine off because they decided it was too loud. He'd take his mask off because he decided it was too cold. She would unplug the hose if she decided it was in the way. So on and so on. Literally everything you could think of that would restrict or cut off his oxygen intake. Then they would panic and call our emergency service when he started to have a reaction to no oxygen intake. I lived not even 5 minutes away, right beside Outham's fire station, and the call would always come to me to fix the machines at random times of the day and night, 7 days a week. They refused to call 911 because they didn't want to make a scene. This went on for ages, well over 18 months, until he was having trouble sleeping one night and shut the machines off before going back to bed. It's been years, and I still see the wife around town. She always glares at me as if I'm the one who lost him. Story 5. Saw a chart once where a person came in for a burn to their eye. They told the doctor they read online that warm milk in the eye can help with irritation, and their eyes were irritated. So they boiled milk and then poured it in their eye. Burned it all. Story 6. Optometrist here. If I had a nickel for every time someone said they use urine for eye drops, I would have 10 cents, which is not a lot, but it's weird that it happened twice. Story 7. Not me, but my wife, who is a vet. Had a client who got mad at her because he didn't realize that once he neutered his dog that he wouldn't be able to breed it. Story 8. This happened in med school on my obstetrician-gynecologist rotation. Patient. Who's the baby going to look like? Me. What do you mean? Patient. Well, is it going to look like the dude who got me pregnant or the guy who's been nutting in me the last few months? Me. Utterly speechless. The baby should look like the people who conceived it. This person is now a parent. Story 9. Lady brings her baby into the ear with a rectal temp of 103. Kid's tacky as hell and looks like crap. Refuses all medications. Says she doesn't believe in them and wonders why her herbal tea, she brought a jug of it, isn't working. Wants us to just check her out. Thinks a children's emergency room just checks them out. Try to explain why the kid needs an NSAID. Keeps refusing. Says she doesn't know what's in it. I bring up that fact she had her kid in a hospital and that she recovered medication herself. IV, epidural, etc. And doesn't budge. Only concerned for herself, told her that when the kid has a seizure or goes unresponsive and you call 911, you can expect the medics to give the kid everything it needs regardless of whether you like it or not. Only when the doc threatened to contact social services, she start to listen. For like 5 whole seconds, left against medical advice. People like this exist and breed. Story 10. Had an adult male patient who needed a Foley catheter. His mother was in the room and they both lived together in the backwoods of TN. I informed them both of the order for a catheter, how it works, and why it was needed. His mother stated, well, he's still a virgin and I'm not sure I'm comfortable with his virginity being taken in a hospital. Story 11. So, you're lactose intolerant? Yes. And you knew this before? Yes. And you drank a milkshake? Yes. What size? Large the rest of the night was the kid screaming and groaning in the ed waiting room. Story 12. My sister told me a story of a woman with chronic blisters and lesions on her lips. They couldn't figure out what it was for weeks. It would heal and come back, heal and come back. Turns out she would jam out on like 3 bags of salt and vinegar chip a day for weeks at a time until the sores hurt too bad to continue. Then she'd go to the doctor. Story 13. Not me, but my mother would pick up shifts as a nurse sometimes in labor and delivery, and she had met a handful of women who didn't know the baby was going to be coming out. Like no clue. My mom usually said something like, "How you got it in is how it's coming out, honey." This was the late 90s, early 2000s. Story 14. I worked ed for 10 years. Every day. Every day people come in and it shocks you how they managed to evade death for that long. One of the worst was we had a guy come in. He was a twin. He told us he needed to get checked for STDs because his sister apparently just got one. We, of course, had to ask if he has had sex with her, and he said no, but they were twins, so what she has, so does he. After a collective sigh of relief that this wasn't some weird Alabama, "you're my sister" crap, we had to educate him. That is not how it worked at all. Story 15. Had an 18 or 19-year-old girl come in my ear with some complaint that required an x-ray. It's standard that we do a urine pregnancy test prior to imaging on any female of childbearing years. She insisted she'd never had sex, and there was 0 possibility of pregnancy. We did the test anyway, and it resulted that she was pregnant. We did a blood pregnancy test to confirm the result. Since she insisted she couldn't possibly be pregnant because she'd never had sex, that was positive too. We gave her a few minutes to herself to figure out what the hell happened. And when I returned to check on her a short time later, she asked me if she could get pregnant even though her boyfriend didn't go all the way in. Story 16. 73 here. Former clinical microbiologist long ago. Still, I found myself all over the clinical lab at times. Not just infectious disease. So, one day, this 20-something guy, wife and mom in tow, walks in with a paper request for semen analysis. Pre-computer era. Okay, not the most comfortable encounter, but I'm a professional and did this drill many times. He had not been briefed by the doc and had no idea how establishing infertility in males was done. Well, okay, a challenge then. I took him aside and, using standard medical terminology, told him how a diagnosis is made and what he needed to do to provide a specimen. He wouldn't believe that I was asking him to pleasure himself into that container. Astonished. Then he played dumb, as if the word was unfamiliar to him. We looped through the medical terms and procedure again, and I eventually resorted to every word I knew to describe the act. It was like a George Carlin bit. A half hour later, he emerged from the toilet with 2 inches of urine in the cup. The report went back. Patient provided improper specimen. Story 17. Optometrist here. Patient booked in for an emergency appointment with a raging red eye. Clearly very painful. Look under the microscope and the cornea is really not happy. Wobbly reflexes, haziness, the works. Me. What happened? Patient. It's my niece's wedding this Saturday, and I wanted to tint my eyelashes to match my hair and the color scheme of the wedding light blue. So I used the same dye for both to match the color. Me. Does that hair dye contain ammonia by any chance? Patient. I think so. Do you think my eye will be better by Saturday? Will it match the color scheme? Me. Unless you can convince them to change the color scheme to red, no. I remember a story from a colleague. Patient attends a routine test, complaining of gradually reduced vision, which turns out to be due to cataract. My colleague offers referral for surgery. No need, exclaims the patient. I know what I need for this. I have lapis lazuli at home. 6 weeks later, came back for the referral. Elderly patients attend with concerned family members because the patient ran over a pop-up tent in the side of the road that the telephone engineers used to protect themselves from the rain. Luckily, no one was hurt as the worker was on lunch, worried as to how the elderly driver missed seeing a large red and white tent in the middle of the day. It was then that the elderly relative admitted to having spent the last 3 years driving from memory. Story 18. Plenty. Although the one that always sticks in my mind is a patient I met during my early years on a palliative care ward suffering from terminal cancer. She was only in her early 30s, and the only reason she had gotten so far gone was that she had relied on the healing power of crystals rather than, chemotherapy. Story 19. EMS here. Had a diabetic in his 40s who refused to take insulin since 2012. It was 2020 at the time. When I took his blood sugar, his only read as high, meaning it was over 700 for glucometer to not read it. Upon seeing this, he asked me if that was high and then went, "Is this cause of all the ice cream I ate?" Played Facebook Messenger video with his girlfriend the entire time. Met him later on the parking lot after he got discharged. And it took this man less than 50 paces from the ER door to rip off his bandage covering his IV and play with the IV wound until it started bleeding all over the place again. Knocked on our ambulance door and asked for a Band-Aid to fix it. We had to walk him back into the ER and bandaged his entire arm with gauze so that... Story 20. Not a personal experience, but one from a colleague of mine. I only saw the pics. So this 60-something-year-old suffers from an acute complication and gets a pacemaker to solve the problem. Everything goes normally, and as planned, he recovers. Every care and meds that he needs to take are prescribed, explained, and medical appointments with a cardiologist, arrhythmologist are scheduled so that he may get the follow-up he needs. The man then proceeds to never show up to any appointment and never answer any calls from the hospital to know of him and reschedule. This went on for around 3 years, until he shows up without former warning and asks to talk with the doctor that did the procedure to put his pacemaker. People are weirded out, but seeing that on that day the doctor was present and this patient was in clear distress, they talk to him and manage a couple of minutes to have the doctor check on him. Inside the appointment room, the doctor takes notice that this man is wearing a bra inside his shirt. The man explains he has been wearing bra for 3 months after his problem got worse. The shirt is asked to be taken off, and there he stands. The shirtless man wearing his bra, showing off the pacemaker, that should have been kept inside his body, dangling outside of it, being held by the left bra cup with a big infected open wound above it with the pacemaker leads, still inserted onto his veins and connected to his heart. Nobody has any idea how the man let that situation come to be or how he didn't die of sepsis or any other health problem that may appear for that matter. Story 21. I don't know if cleaner in a hospital counts, but this one time I got to work early on a Saturday morning, and we immediately received a request for help from the ear and got sent over by my boss. When I got there, the first thing I heard was yelling from this guy behind one of the curtains. He was shouting at the nurses, "Don't touch my junk! And I didn't use any substances!" Then I smelled iron in the air, and then I found out there was blood all over the hallway. What happened? The guy pulled out his catheter, causing arterial bleeding, and decided to run away from the nurses who were trying to help him. It seems like he lived through that. I never seen that much blood before that day, nor after. Story 22. I'm a pharmacist. One evening shift, I was working a relief shift, not my usual pharmacy. A man comes in looking distressed. Man, I had relations with a woman I do not intend to pursue a long-term relationship with. Yes, he said it just like that. Me. Okay, I'm assuming there was an accident or it was unprotected. How long ago did it happen? Man. Last night, at 7 p.m. on the couch. Whoa, TMI, I just need to know approximate time to know if Plan B will work. Oh. Me, we have this medication called Plan B. And since the incident happened within 72 hours, man. Oh yes, I got that for her already yesterday right after we finished. We want to know if there is anything we can do to know if she is pregnant now. Me, unfortunately not. She'll have to wait 3 weeks or so to see if she gets her period. And if she doesn't, then she can do a pregnancy test then. Theoretically, you could do a blood test for faster results. But that would also not be until a couple of weeks, at least. Man, we're just really anxious because she really doesn't want to be pregnant. Is there anything that she can take to prevent the pregnancy? Any multivitamin, minerals, food? Me. She's already taken it, which was the Plan B. There are some other options, but those are prescriptions. And no, there are no over-the-counter products she can take. Man, what about me? Is there anything I can take now to prevent the pregnancy? Any multivitamins or minerals? Me. No, sir. There isn't anything you can take now. Story 23. I overheard a conversation between a nurse and a doctor and a patient in the ear. They were trying to figure out if he was very stupid or has a head injury. It was both hilarious and sad. He kept telling them that he was there for a hurt leg. He couldn't explain why his leg was hurt, how it was hurt, how he got there, nearly anything. I heard them taking in a hallway to each other. The nurse was convinced he hit his head. The doctor said, "No, he is just an idiot." Turns out the doctor was right. They go a hold of the guy's wife. She basically told them in the hallway he's always this dumb, and if she leaves him, he would get lost in his own house and starve. It sounded like his leg was visibly injured or swollen, but when asked what happened or how does it feel, he gave nonsensical idiot answers. Not like slurring, but in a regular idiot voice. It feels hurt. I was talking to Jimmy and we were doing our usual work and my leg hurt. Doc, did something happen? What is the work? Him. Something always happens. You know how it goes. I just want my leg fixed. Story 24. This was one of the funniest yet cutest one. Was a student doing a shift in andrology, reproductive health doc. So you're trying to have kids but not managing to. So do you have any other kid? Patient. Yes, doc, I have one. Doc. Okay, so we need to do this and this and that. Patient. Okay, great. Then he proceeds to visit him and stuff, after which he goes away. After a couple secs, he knocked the door again, saying, "Hello, doc. My wife told me that it would be relevant to you that the son I have is adopted, but that's make no difference to me. I always considered my own son." Story 25. Paramedic. Elderly woman complains that her mouth is dry and she felt a bit dizzy climbing the stairs earlier. Go through the whole rigmarole of getting a medical history. Vitals. More detail on symptoms. Ask her what she's had to drink today. A cup of tea 10 hours ago. Any water? No. Guess what fixed it within 5 minutes? Story 26. Not me, but sibling. I don't think he'd mind me sharing the story just on the off chance it prevents someone else from making this mistake. Lots of surgeons have a similar story, but thankfully this one doesn't end in someone's death. Parents claim their child hasn't eaten anything before surgery, as they were carefully directed. Turns out they thought the surgical team was just being cruel to their child, and when she said she was hungry that morning. They detoured on their way to the surgical center and got her a full Southern breakfast. She damn near passed aspirating biscuits and gravy. I've rarely seen my brother so angry and disgusted. Somehow biscuits and gravy looks even more nauseating the second time around, and he was just recounting what had happened. I have no doubt he tore a strip off the parents once their 5-year-old was stabilized, and they probably still felt justified and angry at the surgeon for telling them what they could and could not feed their child right before anesthesia. Either the parents did in fact feel justified and hard done by, although I think they didn't express anger at my brother. Knowing him, they didn't get a word in edgewise. Definitely no acknowledgement or realization that they could easily have killed their own child or that they'd made a bad decision. I remember they were annoyed by her whining for food. Story 27. A woman called 911 because a cougar attacked her cat. She thought we could help the very clearly dead cat. A man called 911 because a cow bit him. He didn't want EMS or an assessment or anything. A man called 911 for an itchy butthole. Took him to the ED because we have to. The doctor asked the patient if he had put the cream on his butthole that he gave him last time. Patient said no. Next time patient called us for his itchy butthole, I offered to put the cream on his butthole for him. He declined. Took him back to the ED. Story 28. Working midnight in the ER. Family brings in a 4-year-old at 2 a.m.-ish. I ask them what is wrong. Them. Ask him, the 4-year-old. He said he needed to see a doctor. Me. Did he say anything was wrong? Them. No. He said he needed to see a doctor, so brought him. A quick back and forth that firmly establishes that they actually showed up in the ER at 2 a.m. Purely because the 4-year-old said he needed to see a doctor and they don't know why. Meet a child. Why do you need to see a doctor? Kid. The doctor has suckers. To be clear, it is the parents who lack sense and not the kid. Story 29. I work in clinical research at a hospital. Basically, for patients who have cancer and don't have other standard of care options, clinical trials, experimental treatment, are a viable option for many. Some people have a negative view of research, but it's highly regulated and not as scary as it sounds. We go through the consent form with this patient who has a history of substances abuse. We don't know everything about this new medication, but one thing we do know is that using substances while taking this will make your heart explode, in layman's terms. This patient promises they're off the sauce and that they totally won't do this while they're on the trial. 2 weeks later, they relapse and, well, you can figure out the rest of the story. Story 30. Woman comes in with no prenatal care to labor and delivery in labor. OB-GYN resident taking a history. Do you have any allergies? Patient. Yes, I'm allergic to water. Resident. Okay. What kind of reaction happens when you drink water? Patient. Oh, it makes me pee. Yeah, lady, that's a feature, not a bug. Story 31. I'm a nurse. This isn't about a patient rather than my dad. He's convinced that insulin is what is giving people diabetes and doctors are prescribing it just to make money. After 30 minuets of telling him why that's wrong, he said not to be so liberal, and I didn't understand because I'm not a doctor. Story 32. My wife is an anesthesiologist. When training junior doctors, one of the things she has go reinforce over and over again is that you never leave substances unattended in an unsecured area in a hospital, even for a moment. Because some people see substances and think, fun, and take them even if they don't know what they are and they just raided a trolley or picked up a syringe off a bedside table. And then, because the medics used for anesthetics in hospitals are quite serious, those people quite likely end up pass or vegetables. And this has actually happened more than once in hospitals she has worked in. Story 33. Had a buddy who was an EMT. He was called out to a location for a gunshot wound. Apparently what happened is a father was mowing his lawn when he accidentally touched part of the mower near the engine and burned his hand. He got mad at the lawnmower, pulled out his pistol and shot it. The bullet ricocheted and hit his son in the leg. Story 34. When I was in the hospital as a patient, there was this one guy in her who really wanted to step outside to smoke. The nurses pretty much belted him on the table and yelled at him that he had complete kidney failure, and they need to treat him immediately, or he will pass in the next 20 minutes. To their dismay, he didn't listen and tried to vehemently free himself and go outside and smoke. He was in his 30s. It's a mystery to me how this guy survived that long. Story 35. Former vet tech. Had a woman scream at me and my vet for telling her it's the law to have your dog vaccinated against rabies. She said the rabies vaccine causes autism in dogs and makes puppies stupid. Side note, 3 weeks later, her puppy passed of parvo. She got another one immediately after and did not clean her home. 2 more passed in the following months. Animal control and the city had to get involved. Story 36. I'm a dermatologist in India. As is the culture here, people eat with their hands, and almost all of our curries, or even other dry side dishes, have a lot of turmeric. It is common knowledge to anyone born and brought up in India that this means the nails of your dominant hand, statistically the right hand, are going to be yellow stained because we have seen this happen since our childhood. Usually this wears off in about a day and a half if you wash it a couple of times. Cut to the first patient in my OPD, a young girl in her early 20s, very anxious. Me? What brings you here today? Patient. Doc, my right hand fingernails keep getting yellow discolored. Me. Only right hand. Patient. Yes, and only after meals. Me. Do you eat with your hands? Patient. Yes, always. Me. So, you know it's just turmeric, right? Patient. Yes, but can you make it stop happening? Me. Use a spoon. Patient. So you mean there is no medicine to make it stop? Me. Silence. Patient. Silence. Me. No. This might hit home more with people of South Asian cultures or people who habitually eat turmeric-cooked food with their hands. Anyway, for a grown-ass person to complain of this was just well surprising and a little ridiculous. Story 37. Once had a guy come into the emergency room because he snorted a random white powder found in a plastic bag left on a random bench in the middle of a sketchy park and started feeling his life. Story 38. Physical therapist had a patient with neck pain and spasms, also complained of anxiety and heart palpitations. Asked about caffeine intake and patient revealed drinking an average on 20 cups of coffee daily. Story 39. Go see patient in labor. Explain through the whole risks, benefits, and process of a labor epidural. Finish up procedure and have just secured the epidural catheter to the skin. Husband asks, how is she supposed to pee through that small a catheter? Story 40. I worked DIMS for years. It never ceased to amaze me the things people will do to themselves or others for fun. Confronted with these types, my first question was always, at what point did this seem like a good idea? The weirdest one I can remember was a guy that put his junk through a large metal nut. He couldn't get it off. Story 41. My aunt. She was diagnosed with cancer. Instead of getting treatment, she went hardcore vegan and prayed, refused to use any med. Doctor said she could have made it for a few more years. She passed after 6 months. Story 42. Pharmacist. Don't even know where I would begin for some of the ridiculous situations I have had. Up there, however, has to be whenever I had a lady swallow a full box of suppositories and came in to complain that the issue is not cleared up and the medication tasted bad and was hard to swallow. Do sometimes wonder how people put one foot in front of the other? Story 43. My brother did a rotation in an era before med school. Paramedics brought in a man with a hit neck. He was drunk and fell into a fish tank. His drunk buddies called 911. When the paramedics arrived, they realized his drunk friends had put a very tight tourniquet around his neck to stop the bleeding. Story 44. Okay, so not a medical professional, but hear me out for a second. I work in a gym and recently had a client come in for an induction, basically walk through the gym design program based on goals, needs, and physical capacity. The client, in her late 70s, has a shoulder injury, which the physiotherapist has said. The rotator cuff is barely attached. The client has been suffering severe pain for years and hasn't been able to use that shoulder and refuses to go to the doctor as she doesn't want to see a surgeon, doesn't want surgery. I've echoed what the physiotherapist has said and have refused to do any upper body exercises because of how bad the injury is. The client would rather live in severe pain than seek necessary medical treatment and only takes pain relief medication when the pain is intolerable. Story 45. I'm not a medic, but an environmental health officer that investigates infectious disease. Sources, causes, exposure. I had a case in a 2-month-old of Campylobacter, food, waterborne poisoning. The mother called me and asked, how could she get it when it comes from chicken and she's vegan? When I say vegan, the mother meant they were treating the baby as vegan. No breastfeeding or milk substitute. Story 46. Smoking on a public sidewalk and twists her ankle. Decides to call the police for help and then continues to smoke substances as they arrive. Police then promptly arrest her and she becomes my patient. Story 47. EMS checking in. Late 20s male called 911 for a mild headache, no alarming symptoms, middle of allergy season. Being good medics, we check all the things, totally normal vitals. No fever, no medical history, just a mild headache that started about 30 minutes prior. Do we take Tylenol or ibuprofen or anything? Nope, he wanted to go to the ER to let the doctors handle it. Imagine the bills. Story 48. Nurse here had a patient with a tibial plateau fracture that demanded to see the doctor because she wanted to quit her antithrombotic medication. Bad idea. According to her, it gave her a dry mouth. I explained to her that it was no known side effect of that medic. This lady had type 2 diabetes and administered her own insulin. Dry mouth is a side effect of high blood sugar. Tested her blood sugar, it was too high. Turns out she was using the same needle twice. These particular needles are single use, so she only got half the dose. Story 49. I worked in cancer research, surgery, a couple years ago. There is a good amount of people who will refuse to have a small removal. Surgery, because they think holistic medicine way will work. They always come back and we always have to remove so much more. One time a patient had a melanoma on their calf and the doctor wanted to do a simple wide excision, but they left. Came back a couple months later because it got bigger and we had to amputate their leg. Pretty sure they had positive lymph nodes at that point too. Story 50. My wife used to work at an urgent care in an undereducated community. I'd guess most of her patients would have you wondering how they made it to adulthood. Some notable patients. 1. The guy who, after learning he had diabetes, vowed to make a life change and replace all his soda with Gatorade. 2. Women who don't know anything about menstrual cycles. 3. The people who come in with a history of heart attacks and chest pain. That feels like a heart attack, but I know my body, and it's not a heart attack. It was always a heart attack. 4. Guys with gross junks, hygiene-related. 5. People who did their own research. 6. The parents who didn't get their normally not complainy teenage daughter medical attention when she was screaming in pain. After finding out she had appendicitis, they took her home instead of taking her to the ER. Bonus. My kid was in the hospital and sharing a room with another patient. This kid was morbidly obese and was elbow deep in a family-sized bag of potato chips. The doctor came in and really gave it to the mom. Your kid has kidney failure and he's not supposed to be eating salty foods. Your kid has a major condition and you've missed the majority of his appointments. Story 51, physiotherapist. For those that don't know, after a total knee replacement, you basically have a 6-week window after the surgery to regain the range of motion. If you don't regain the range in those first 6 weeks, it ain't coming back. Had a patient who was a farmer who was very enthusiastic about regaining the range because he needed to be mobile for his work. Saw him the first time about 5 days after surgery, showed him all the basic exercises, told him to not do any farm work for at least 6 weeks, and told him to come back to see me once a week for the first 6 weeks. He disappeared and came back about 8 weeks later. His range was non-existent, maybe 30 degrees of range in total. He was visibly mad at me, as if it was my fault. Actually was shouting and calling me incompetent. Our conversation went something like this. Have you been doing the exercises? No. How often are you doing farm work? Every day. Why haven't you come back since the first appointment 8 weeks ago? Too busy with farm work. So to summarize here, you did absolutely nothing that I told you to. And this is somehow my fault. Never saw him again. Story 52. Not a medical professional, but a grandson of a patient. My grandma went to ophthalmologist to get her new glasses. Her doctor wanted to get her to do surgery for cataracts. But my grandma was very rude and stubborn in her denial to do that operation. Her main reason? She wouldn't be able to bend down for some time. That's right. My grandma would have rather chosen to go blind than to inconvenience herself in a slight way. Luckily, we managed to convince her to do that operation. My parents, brother, and I. She awaits her appointments. Story 53. Just yesterday, a child patient needed a blood transfusion. The mother was apprehensive because they thought their kid could be vaccinated through the transfusion. Story 54. When I was an intern post and in the obstetric department, I saw a 42-year-old pregnant woman who came for an antenatal checkup. This was her 7th pregnancy, and she had only one living child. So she had 5 pregnancies previously, which failed. The 6th one was high risk too, and she had to get cervical circlage done. When the obgyn asked her why she would put herself through pregnancy again instead of being content with her daughter, she replied, "My in-laws want us to have at least 2 children. Biggest Pikachu face moment in my life." Story 55. Not me, but my ex-wife works as an endoscopy nurse. People have to use laxatives because they have to be clean for the doctor to be able to see with the camera. With the laxatives, they have to drink a lot of fluid, 3, maybe 4 liters, total IRQ, about half gallon to a gallon. Some people just don't do it because it tastes bad. Some people do laxate, autocorrect said lactate, but still eat. Some think the doctor just won't notice. Yeah, Margaret. They won't notice that your colon isn't empty when they go in there with an HD camera. They just don't understand why they do it. Even though everything is explained by the doctor, and they get brochures and a link to the website via email. And believe me, I've seen the brochures and website. An average 8-year-old could understand. Also, a funny story from her. There was a teenage brought in with a sex toy inside. He didn't need surgery, but they did have to use some tools to get it out. After the procedure, he apparently asked for the sex toy back because it was his sister's. Answer was no, it was cleaned and they have a trophy cabinet. Story 56. Not a medical professional, but I used to volunteer at a free medical clinic to take vitals and histories. A woman came in with pneumonia and wanted to know why her normal treatment of drinking half a bottle of Listerine and smoking a pack of cigarettes a day wasn't working. I asked why she thought smoking was good treatment for a lung infection, and she said, Indians used to purify the ground by burning all the weeds away before planting, so I'm smoking to purify my lungs. I left that one to the doctor. Story 57. VetMed here. We get a lot of patients who need to go on medications for a wide array of persistent problems, and these medications keep them under control. So we often get ones with thyroid, diabetes, heart issues, etc., and start them on medications. The patient starts to do great, comes in for another recheck, and is awful. We ask the owner if they're still giving the med. Nope, they stopped it because they were all better. We fully educate the owner, go over medications, and give notes on what to do, and they still do this. Story 58. As a pharmacist, everyone who comes in to buy homeopathic crap, especially for serious things. Once a lady came in with a prescription from the dentist for some heavy antibiotics and painkillers due to an infection that threatened to damage the jawbone. When I asked if she knew how to take them, she went, "Oh, I'm not going to take those. They'll go right into the garbage. But I got to buy them so that my dentist is happy. I'll rather stick with insert name of homeopathic crap here instead of poisoning me with some devilish chemicals." Throughout the years, I've learned to just shrug and accept those Darwin Award candidates instead of arguing with them. Story 59? That's most patients. Honestly, they usually get that far through some combination of luck, bordering on divine intervention for some, endless, enabling from family members, and access to emergency care and social services, enabling then to continue. I had one in particular who was a blind alcoholic with Tourette's. He would drink until he collapsed in the road daily and was brought to the ER daily. He survived being run over by a bus and being buried in a snowbank with a body temp in the low 80s, all to leave Amma to drink and collapse in the street all over again, daily. After about a decade of that crap, a leg infection he refused to treat got him. Story 60? Just a former paramedic here, but hear me out. As I was pregnant, my ex asked me, "How much does a newborn weigh?" Me, approximately 5 kilograms. My ex, "And how much weight have you already put on?" Me, about 13 kilograms, 2 weeks before delivery. My ex, "So you put on nearly 10 kilograms fat?" He has a graduate degree in mechanical engineering. Story 61. Story is, he'd been to local carvery for lunch. Ate a big bit of beef that he felt was too big to swallow, but swallowed anyway. After a short while, he felt it was still not fully descended to his stomach, so he drove himself home and called 999. I explained that it was a large bolus of food in his, for simpleton speak, food pipe, not his air pipe. He needed to drink water to wash down and next time either cut into smaller pieces or not swallow. He had 2 young children and a third on its way. These people are allowed to vote, drive. Story 62. I used to be a surgical technologist and have since moved up. One time, some guy thought it would be funny to pretend to have a seizure right as we administered anesthesia. He apparently looked up malignant hyperthermia, which is a severe action to anesthesia that could end in death. And as he was going under, we couldn't wake him, so we had to bring the crash cart out and call a code blue in the OR to get this guy up. We did not do his elective surgery after that. Story 63. I always hate seeing the patient who weighs over 600 pounds and comes to the ED for shortness of breath and refuses to acknowledge that their weight may have something to do with it. It's not their weight that bothers me. It's the utter lack of common sense. Story 64, pharmacist here. I had a woman bring in a literal sandwich bag unseparated which she kept all her meds in. She needed help seeing which meds she was low or out on and asking different questions on the medications. When she pointed to an epoch stating it was her blood pressure medicine, I immediately became concerned as to why pet medicine was in her bag. Also why she is mixing all her meds in a bag. In the first place, only to find out that she had been throwing her pet's med inside her bag of medicine. So Lord knows what she's been giving her dog, or taking herself. I immediately stressed how important it is to keep medicine in its original container to protect the medicine, and herself, and to know the directions of how to take it. I've seen her a few times since then, and glad to see she has since taken my advice. But how any pharmacist or doctor hasn't advised her on this before is beyond me. Story 65. I worked for an Obgyn who had a patient he prescribed suppositories for. When she complained of no improvement, she came back in for another exam. He found 7 foil-wrapped suppositories inside. Story 66. I work at a hospital and I legit had someone who believed that the only way to improve their eyesight was to close their left eye and squint with their right. When asked about glasses, she said, "I'm not into that fashion trend." Story 67. While in PA school, I was educating a guy and his pregnant wife on a vasectomy. I'm about halfway through my deal when he cuts me off and asks, "Just give it to me straight. Can I keep them in a jar after?" Dude thought he was going to get his balls lost at the request of his wife. Needless to say, he was very happy and much more on board to go through with the procedure. Props to him for thinking he was literally getting his balls lost to prevent having any more kids. Story 68. Lady took her friend's blood pressure medication because she thought without measuring that her blood pressure was high, had a severe reaction. Home with EPI pen-type reaction. Then, went home to take the bloody medication again, further anaphylaxis. Story 69. I started my career working on methods for the genetic diagnosis of cystic fibrosis. One of my parents was worried I'd catch CF from handling DNA samples from affected people. It's a recessive inherited disorder. Story 70. Nad but a patient. and was room sharing with another girl who needed surgery. Her instructions were not to eat. Every few hours, she'd convince someone, family members, to bring her fast food. The doctor was frustrated and refused to do the surgery till she stopped eating. She needed a clear stomach. She could not get a grasp on this and said she had no choice but to eat because she was hungry. I was moved to another room on the third day, but she still hadn't had surgery by the time I had moved. Story 71. Ambulance service in the UK. Our summers now top 40 degrees with very high humidity, and our buildings are mostly built to retain heat and rarely have AC. I regularly attend people, mostly the elderly, who are sat in the extreme heat wearing multiple thick clothing layers with the windows shut. Ask them if they've been drinking plenty of fluids. Oh yes, I had a cup of tea earlier and my porridge had milk in it. I'm no Quincy, but I think we might have narrowed down the source of you feeling unwell. Story 72. Someone asked me how you catch a stroke. This is, as the partner of said person was on the floor, unable to stand due to left-sided weakness of no power. They both thought he could sleep it off overnight and be fine in the morning. 12 hours later, they decided they'd phone the doctors to ask if there was anything the doctor could give the person on the floor, who was also now incontinent. They didn't even get worried during the previous day when his face drooped on the left side and he was slurring his speech. I said he has had a stroke. Oh, how do you catch one of those? Story 73. I work in veterinary medicine, and clients are absolute idiots who are convinced that they are the smartest people in the world. It is amazing that pets actually manage to stay alive. People will believe just about anyone else over the advice of their veterinarian, their breeder, their relatives, their lawnmower, the person bagging their groceries. I had a client blind their cat with tea tree oil because they read about it on the internet. Clients change their pet's medication dose for whatever reason. That's really fun when it is insulin. Not follow post-op instructions causing their pet to blow the knee we just repaired. Feed their dog pot roast with garlic and onions as their bland diet for GI upset. Heck, last week I had a client scream at me because we didn't give her an exam room with a view. We don't have exam rooms with outside windows. Story 74. Every day. Once had a 36-year-old girl for sent and broke her leg sitting on the toilet. After talking to her, found out she had cancer she was trying to treat with herbs. Well, cancer spread to her femur, and she snapped it. Pretty sad. Story 75. Saw a comment once of a woman who was advised to eat a packet of oatmeal for breakfast each morning to help with her weight. She came back in for checkups over the course of many months and was somehow gaining weight faster. And blood work was getting worse, even though she swore up and down she was following the diet. Everyone was baffled until they questioned her further and learned that she had been eating a package of oatmeal cookies every morning for breakfast. Story 76. You're a nurse with 7 years' experience. The list is near less endless. People with massive burns because they smoked in bed is not as rare as you'd think. But the one that got me the most was a guy who came in for chest pain and fatigue. ICE revealed he was having a really bad heart attack. Activated or cath lab for emergency stents to hopefully save the guy's life. They almost always access the patient through the groin for the procedure, so one of our jobs in the ER is to shave the patient's groin to prep them for cath lab. We get the clippers out, we don't use actual razors anymore, and informed the guy we needed to shave him. He refused. No problem. We will let cath lab do it once he's knocked out. Nope. Guy refuses to sign the consent for the stents because he doesn't want his hair shaved after trying to educate him, pleading with him, and contacting every damn lawyer the hospital has. The guy signed himself out and went home. He would rather die than have his curlies shaved. We looked up his address and we weren't the closest hospital, so if he died at home, medics would take him to a different hospital. Doubt he survived the day. Story 77. I've been a firefighter for a very long time. One of my most recurring thoughts is, how did this person survive to adulthood? I had an elderly patient at around 2 a.m. The conversation went like this. What seems to be the problem? I don't feel good. Okay, what specifically are you feeling? I don't know. I just don't feel good. Are you on any medications? A bunch. Hands me a list. Have you been taking your meds like your doctor told you? No. When was the last time you took them? A few days ago. When was the last time you ate? A few days ago. Have you been drinking water? No. Have you been drinking anything? Pepsi. Okay, so you haven't eaten or taken your meds for at least 3 days? And you've drank nothing but Pepsi for 3 days, and you don't feel good. Another common issue is people having absolutely zero idea what their medical history is, what medications they take, or why they take them. Do you take any prescription medications? Oh yeah, a bunch. Which medications do you take? Oh, I don't know. There's a lot of them. What do you take them for? Trying to get a sense of their medical history. Oh, a bunch of things. Are you a diabetic? Heart issues? Breathing issues? Cancer? No. Can I see your medications? Here. Hands me their weekly pill box. I need to see the prescription bottle. I don't know what these are just by looking at them. Where are the bottles? I don't know. Story 78. I have heard a story about a patient on whom it was impressed that she couldn't miss her fractions of radiotherapy if she was busy, and to inform us if she couldn't make the appointment, she couldn't make it. so she sent her twin sister to receive the radiation therapy in her place. She answered yes to all the ID questions, had the same birthday, etc. It was noticed when radiographers had trouble matching her to the CT because the CT was of a person who had undergone a mastectomy, whilst the patient still had both breasts. This, many years later, is told to new staff during training about the importance of ensuring correct identification, because you would be stunned the number of people who try to skip the queue. The number isn't high, but it isn't zero. Story 79. I work in home health. At my last job, I had a lady call saying she was returning my call specifically. I don't recall her at all, and when I check for anything on her, it shows we have never received a referral or anything for her, which I tell her. She gets mad and starts screaming at me. Won't let me get a word in to tell her to call the discharge planner at the hospital. Like a good 8 minutes of her screaming at me, calling me heartless, an idiot, you name it, whatever. It's slow, and these calls are usually good for a laugh. She takes a breath. I say, "Ma'am, I'm not sure who called you, especially since we haven't heard of you before now." She interrupts with, "No, it was definitely you. You said your name was Shelaton and you were calling from Advanced Home Health." We have detected the problem. I tell her, "I see what's going on. You accidentally called Amber Care Home Health. Let me get you Advanced's number." Then she says, "I have it. They didn't pick up the phone, so I called you guys." I was not expecting that one. Story 80. Wife brought dude to the ed because he wasn't really talking to her, or doing much for that matter, for 4 days. Turns out he stopped taking his blood thinners because I don't feel any better when I take it, and they could not afford it, ducking American healthcare system. Anyways, he had a huge stroke. Please, bring your loved ones to the ed immediately when they cannot talk to you. And for duck's sake, do not stop taking your anticoagulation unless a doctor tells you to stop. Story 81. Uninteresting common version. Uncontrolled diabetics screaming at the top of their lungs, demanding 3 Ensure chocolate smoothies and 2 sandwiches and 5 orange juices for an after-dinner snack, while having the Accu-Check flag his blood glucose levels as critical 500 inches while also freshly amputated. Oh, and he'll follow you around the nurse station all day. Story 82. Diabetic patient with foot ulcers that kept being infected with a lot of different gut microbes. Turned out he used to put his foot in the toilet and scrub the open ulcers with the toilet brush. Story 83. I work in orthopedic rehab. Had a patient with a common fracture of the wrist the doctor sent over since she was inexplicably getting stiffer and stiffer. I spent 17 sessions with her, 40-ish minutes each one time. Instead of just bending her wrist, she would contort her entire body. She had a career, married, raised kids, and seemingly functional adult. I tried everything to have her actively use her muscles to move her wrist. In front of a mirror, videos of myself doing the exercise, her doing it, and trying to spot the difference of moving your shoulder versus your wrist. The last time I saw her, I even strapped her arm to a chair, and she didn't understand she was just trying to move her wrist. I will never understand it. Story 84. A family member's worked at a hospital and had a patient come in with really strange physical and seemingly neurological issues. Couldn't figure out what was causing it. Didn't match anything he knew of, and tests were inconclusive. He asked her to walk him through her day. Turns out she was drinking a cup of bleach a day and bathing in it to keep clean and healthy her whole life. Same with her family, who all died very young. She could not accept that drinking bleach was bad for her health. Story 85. Respiratory therapist here. I was working in the ER one night, and we have a prison not far from the hospital I was working at. We had a prisoner come in one night, and the doctor asked me to get an EKG on him. I went into the room, did the EKG, and gave the results to the doctor. I asked the doctor why he was here as the prisoner was acting okay and didn't appear to be in any sort of distress. The doctor told me he was here because he shoved a flex pen up his junk. The doctor asked me if I wanted to watch the pen being removed. I proceeded to return to my office. The next night I worked, we had a different prisoner come in for the exact same thing. Story 86. I always ask doctors or nurses this when I can. Even though I'll never share names or places, my top 2 are. A family brought a 14 years OLS male to the ER complaining of severe stomach pain. It turns out he ate a whole bag of spits, seasoned whole sunflower seeds shells and all. He passes a couple days later because they couldn't remove them from his small intestine at that point. Someone was eating meatballs and dropped one. He bent down under the table to get it and bumped the table. A fork fell. He looked up. Fork inside. 4 HRs of reconstructive surgery later, his eyeball was saved by this amazing human. I'm not doing so bad. Story 87. I'm not in the medical field. I just work with somebody who refuses to either get medical advice or follow it. His health has been getting progressively worse over the last few years. He says that he just wants the pain to stop, yet refuses to change any habits. Big alcoholic and chain smoker, and he's obese on top of that. We're all tired of listening to him get day after day. I can't imagine what it's like to treat patients like him every day. I think I'd lose it at some point and blow up. Story 88. I'm not in medicine, but my wife is, and got this story. An old man was admitted to their burn unit because he was smoking cigarettes around his oxygen tank. and it exploded. Severe burns across his face and chest. This was the third time it had happened to him. Story 89. Had a patient when I was a pharmacy resident get repeatedly admitted to the hospital due to CHF complications, shortness of breath, fluid overload, etc. She had been advised to follow a low-sodium diet, but no one had asked her what she had actually been eating. I asked what she usually ate for lunch, and she said instant ramen noodles every day, but she only added the seasoning packet and a little salt. Story 90. My wife had one yesterday. A person came in with a baby. The patient said, "Well, I can't speak for the baby, but I have a cough and a sore throat." My wife asked, "If you can't speak for the baby, then who can?" The patient was dumbfounded, perplexed about who could speak for her baby. Story 91. I know of a doctor who once had a patient come in for burns on both of his hands. The patient had been working with hot glue gun and thought that the glue didn't actually seem to be very hot, so applied some to the palm of his hands to test the temperature. It was extremely hot and painful, so the patient attempted to remove it by grabbing it with the fingers of his other hand. I was the patient. Story 92. I was in my last year of internal medicine residency, spending a month covering nights at one of our local hospitals. A nurse paged me around 10 p.m. with the message, "Can't place Foley and PT in room XX." On my sign-out list, it said the patient was a 70-year-old man admitted for advanced heart failure and needed the Foley catheter to track urine output, while the team was trying to diuresis the fluid off of him. I head over to the ward. This patient was on and asked the nurse what the issue was, and she said I just needed to talk to the patient about it. Okay, odd, but whatever. I stroll into the room and meet a pleasant, older man sitting in his bed. The conversation immediately went, weird, me. So what sort of problem were they having with the catheter? Were you having a lot of pain with it or something? Patient. Oh no, nothing like that. They were just putting it in the wrong hole. Me. The wrong, huh? I'm not sure I understand. Patient. Well, you know how every guy has their pee hole and their semen hole? They were putting it in the wrong one. Me. Sir, I'm going to need to examine your junk. It turns out this guy had a hypospadias, which for his entire life, he had thought was just how a junk looks, because that's what his mom told him as a child. He literally had an accessory hole in his junk and just thought, yep, that's how a junk works. A pee hole and a semen hole. Story 93. I'm not a doctor, but I play one on TV. I worked for 3 months as a secretary in a urological clinic. I was regaled with a story about a middle-aged man with a severe rash. Guy tried so many creams, his PCP at one point prescribed steroids, and it's just getting worse. It was a toss-up between a urologist and a dermatologist, and he could see a urologist sooner. The day he finally comes into our office, and when he takes off his drawers, he apparently smells like a wet fart. Turns out this guy was barely wiping his ass, and the swamp-ass mixture he was brewing between his booty cheeks was getting worked forward as he walked throughout the day and bathing his balls with crafty sweat leading to an out-of-control, blistering, oozing rash. Story 94. Not a medical professional, but was pregnant and attending parenting classes at the local hospital with my partner. One of the first classes included a tour of the pediatrics area and a detailed explanation of everything that would happen on birthing day. The nurse showed us some teeny ID bracelets and explained they put one on each of the baby's legs because sometimes they fall off. Cue one of the future fathers totally freaking out. None of us had any idea why until he bursts out with, "I didn't know they could fall off." Nurse carefully and gently explained that she meant the ID bracelets. Story 95. Ed Doc. I save a bunch of ridiculous chief complaints, but I had this one recently. Patient complains of sore gums after eating too many Zapp's spicy Cajun potato chips. PT currently with bag in hand, eating chips. Believe it or not, people come to the IR all the time for stuff like this. People talk about how advanced humans are now, but I just think about these others who are holding our species back. Story 96. Work at a vet clinic. We get a lot of this sort of thing oftentimes with diabetic patients. One of the worst I've seen was an older owner come in with their extremely overweight diabetic dog. Owner says the dog has been slow, tires easily, and has been flopping around, which is odd for her. Doctor checks her blood glucose, and it is so high it is literally off the charts. Normal blood glucose for a dog is around 100 or so. This dog was beyond 1,000. We asked the owners how it got so high. Was she eating? Clearly she was, because she was obese. Were you giving her the insulin? The owners proceed to say that they think she's probably fine without it. She's a strong and hardy dog. Ma'am, your 9-year-old 80-pound Dalmatian is currently half alive on the floor because you don't give her the insulin. How they kept that poor dog alive that long was astounding. Story 97? Plenty. A patient came to me with an inguinal hernia. Just when I was about to examine him, I observed that his ears were pierced and he was wearing a thread through those piercing. I was surprised. Usually I see earrings or some other metal, so I asked him why he was wearing a tiny rope. He said it was to treat the swelling, hernia. To admit that I didn't laugh hysterically would be an absolute lie. Story 98. PEDS nurse. The things that come out of parents' mouths daily is mind-blowing to think they are responsible for the welfare of babies and children. 2 days ago, I listened to a conversation between the ICU doctor and a dad who insisted that his newborn, his second child, needs to be given water, tap water, in addition to his formula, because the human body is made up of mostly water, so how is a baby supposed to survive with no water? That's what they had been giving the baby at home. We figured out the cause of the baby's electrolyte imbalances. Another parent brought their kid in who was severely underweight and had a J-tube for feeding. Upon further discussion, the parent said when the baby cries or seems gassy, they just open the G-tube and hold him over the sink, and once all that extra stuff comes out, he stops crying and feels better. They were feeding the baby, then immediately letting all the formula in his stomach run down the drain before he could digest it. Story 99. I went to a 911 call for sunburns at 2 a.m. This man had called at 9 p.m., but waited hours for us to show up. It was appropriately assigned the lower priority and got bumped by basically every other call all night long. So we showed up. I walk in and see this man, sitting on the floor of his living room, looking completely distraught. What happened? He explains. He has a sunburn on his shoulder from being at a local water park earlier in the day. He says his pain is 2:10. His skin has a slight redness to the upper shoulders and has no blisters at this time. After what feels like pulling teeth, I managed to find out that he applied sunscreen once, but did not reapply because I don't need it. Contextually, he seemed to be implying that his skin tone meant he wouldn't burn, and he has tried nothing for cooling the burn since he got home. All he has done is sit on the floor with his shirt off and make his wife get things for him. At this point, my primary differential diagnosis is that this is a man-child who has never had a sunburn, and I feel bad for his wife. But then she asks me if they can apply yogurt to it. So I explained about aloe vera, suggested they get some and keep it in the fridge, and then ask if he wants to come to the hospital. You know, the thing that I might expect you want to do when you call 911 for paramedics. The people that take you to the hospital. He asks how they're going to help. Not what they could do, but how. I explained that Emerge is likely not going to have much to offer beyond the Tylenol and Advil I've already offered, and he's refused, and then telling him to rest until it feels better, which I've already said. I also told him that they were going to expect him to wear a shirt in the waiting room, where he would be going directly, like he would be walking from the ambulance to the main waiting room, since he met the Fit 2 site criteria. This was not going to be wasting the charge nurse's time. He ended up staying home, and timing-wise it worked out well for me, since I was working a not 15 o'clock to 3 o'clock shift. Story 100. I'm a medical professional and have seen lots of dumb people. But we had a great one where a 80-something-year-old woman was in the ICU for an MI, heart attack. And because she was acting odd, they did a tox screen that came back positive for substances. One of our docs went in the room to talk to her about it, and she loudly proclaimed, "I only did it because my husband had some." Our doc told her that's not a good reason. A little later, her kids and grandkids, all probably 20 years old, came in to visit, and when they figured out what was going out, you just hear them yell, "Grandma!" I got a kick out of that one. Grandma living her best life. Another time when I was in college, we were all hanging out in a dorm room, smoking, with a bunch of people when a friend falls and starts having a seizure. No history of it, so we called 911, and the ambulance wanted someone to ride along with him, so I went. He was post-ictal, hazy from after seizure. And when they were questioning him in the ED, they said, "Ed, so I understand you've consumed some substances tonight, friend?" "Yes, sir, Ed." "How much, friend?" 20G. I proceeded to cry laughing, and the staff was completely confused, not understanding what he meant. Finally, I told my friend they weren't looking to pick up after work. They want to know how much you smoked. Once the staff realized, they got a kick out of it too. Maybe not totally in line with the prompt, but the last one is one of my favorite medical stories while not working at the hospital. Story 101. My dad, who lives by himself, had a stroke. He did not go to the hospital. 5 days later, he called me sister and said he wasn't feeling well. She took him to the ER. That doctors said that him not taking his blood pressure medicine probably saved his life, as blood was able to push past the clot. My dad still has a slur. He still thinks he's doing okay living on his own. Story 102. Not my story, but my dad's. So when he was in med school, he was doing a rotation and talked to a teenager who had went to the restroom and ended up a baby out. When my dad asked about her period, her explanation about why she hadn't had them is that she talked to her cousin and she hadn't had hers in 7 months. She was also one of 8 children, so you think her mom should have been able to deduce what was happening. Overall, not a very bright-sounding family. Story 103. I am a medical professional, but I have 2 really good ones from my ex-fiancé. Laugh at me all you want. This relationship was not my proudest moment. 1. At our baby shower for my son, he asked if we were going to pick Innie or Odie. I looked at him like he was insane. He started getting angry and just repeated the question louder until I shushed him and took him aside to explain to him that we don't choose how the belly button looks. It just happens. 2. He had really bad eczema and went to a doctor for it who suggested oatmeal baths during flare-ups. He bought a couple boxes of Quaker Oats, maple, and brown sugar, and would dump an entire box packet by packet into the tub. It was a couple weeks before I found the wrappers and questioned him about it. He told me, angry again, that he wondered why he was so sticky after getting out, and why the ducking literal brown sugar was making his open wounds fester. I explained an oatmeal bath is not flavored oatmeal, and that he had to buy either plain oats or actual oatmeal bath packets. He was furious that I expected him to just know better. When I asked him why he picked maple and brown sugar, he said he didn't want to smell like strawberries or peaches after his bath. After our son was born and we had broken up, my son also had some occasional eczema, but not nearly to the same degree. Pediatrician recommended oatmeal baths, and guess what this mother ducker bought? He said he remembered the last time when he picked my son out of the sink and the towel stuck to him. When I started to scold him for being so stupid, he looked at me like I was the idiot and told me he only used one packet since we were still bathing the kid in the sink instead of in an entire tub. Story 104. Have a homeless guy right now. He visited the ear 19 times related to a vicious gangrene infection to his right lower extremity. It should have been treated a year ago and amputated 4 months ago. He is under the impression he can use the injury for preferred housing related to medical issues. He is still on the streets. He refuses antibiotics and debridement. Very obviously mentally ill. ASOC is involved. Story 105. Pharmacist here. 2 come to mind, but I'm sure there are plenty more I'm not thinking of. Woman comes in claiming her medication was making her vomit. Says she can't remember what it is called. I look up her profile, and there is nothing recent, just one-off antibiotics and antifungal from almost a year ago. I asked her if it was over the counter, and she said it was. She pointed me to the Monistat cream. I thought it was incredibly strange that a puzzle cream was making her vomit, so I asked how she had been using it. She was taking it by mouth. She says she would fill the plunger with the cream and shoot it to the back of her throat and swallow it, so she wouldn't taste it as much as putting it directly on her tongue and swallowing. Another time, my coworker, another pharmacist, got served a lawsuit while I was there. The patient suffered a fall and concussion and claimed it was because her lisinopril, blood pressure medication, was increased from 10 milligrams to 20 milligrams, and she was not informed and passed out. She was suing the pharmacist, the pharmacy, her doctor's office, and the doctor themselves. It eventually came out in early discovery that she was at a rave and had a back of 0.18 Thc and Mendima in her system. The case against the doctor's office, doctor, and pharmacy itself fell apart right away. So she went all in on trying to sue the individual pharmacist. The pharmacy's POS system confirmed that she checked I decline pharmacist consultation at this time. So the case was eventually dropped. Story 106. I'm a former massage therapist, which means I'm not a medical professional. The issue is that sometimes people think that I am. I'll never forget the one guy who cracked a rib and still came into his session because he thought I could fix it. Story 107. I'm a pharmacist. I work in a primary care clinic now, but I used to work in a community pharmacy with the big 3 letters that none of us like to talk about: people and birth control. I have stories. 1. Patients running out of their pills within 2 weeks because I take one and my boyfriend takes one. So the pack only lasts 2 weeks. Yes, this has happened multiple times too. Patients wearing pussy rings as accessories. Example, a nice bracelet, a nice anklet. You would think this would be obvious, but it's not people. 3. Patients using Plan B as their normal birth control. Attempting to purchase multiple doses at a time and taking after sex every time. Please don't do this. It can be potentially dangerous. Story 108. I am a medical professional, but this isn't a professional story. A few years ago, my cousin was having reflux issues, so she went to get an endoscopy. And the night before she was scheduled to have the procedure, she asked me, "If I am pregnant, do you think they'll see the baby in the endoscopy?" 1. I laughed for over 10 minutes before asking her, "Where do babies live?" And she replied, "Well, the stomach, too." She got actually pregnant not even 6 months later. Story 109. Dentist here. Once a stressed receptionist asked me to help her interpretate a call. I thought maybe the patient was speaking some foreign language. No, she just wanted me to confirm that the patient was asking for his property back, that we took from him last year actually being 4 years ago, but I guess time flies, and his property being a tooth we sent to grind into slides for analysis. While explaining that it was impossible for us to return his tooth, he started going on about his rights and his property to return his teeth. When I tell people to move their jaw to the side, they always ask, which jaw? Actually, not everyone, only adults. Children get the assignment. So, story 110. This was circa 1983. I'm a nurse, retired. Had this one guy in his early 20s that went swimming hammered in a notoriously nasty lake in our area, like a don't drink the water kind of lake, without shoes. Stepped on an old beer tab and cut his foot open. Didn't go to the hospital or try to clean it at all for about a week. His GF said he kept saying, "It's fine, it's just a cut," when she pressured him to get it seen about. So OFC, he shows up in the ER with a foot that blew up like a balloon. 2.5 months in the hospital. Foot completely laid open in surgery, doing debridement. And packing on this foot, which I can honestly say after over 30 years in healthcare, stands as one of the nastiest jobs I ever had to do. And I had been dealing with things like bed sores and open wounds from radiation treatments and cancer for about 7 years at that point. Add to this, he was obnoxious, abusive, and when the opportunity presented itself, cruel. Other nurses, you know the type, they're everywhere. Hopefully not as open about it these days, but yeah. I had a student nurse I was training that came running out of the room in tears and refused to go back in and would not tell any of us what he said, but I can imagine. Finally get it cleaned out, responding well to antibiotics. Tissue is granulating well. He gets sent home with antibiotics and strict instructions on how to care for it and to keep it clean and dry. The day he left the hospital, he went back out to the same lake. Got drunk, put on nasty tennis shoes, and went swimming. Showed up on our floor again a week after being discharged. He lost the foot. His girlfriend left him. Story 111. Paramedic and had this call while I worked on a rural fire EMS service. Call came in for allergic reaction. Arrive at a rural farm and find the PT in the kitchen on the ground wheezing. Husband says she took sulfa, which she's allergic to. And after grabbing her BP, we hit her with epinephrine, same as an EpiPen, and Benadryl. Her breathing improves, and she starts to be able to answer questions. Me. So you're allergic to sulfa, and you took sulfa. PT, yeah, me. Was it mislabeled or in the wrong bottle? PT, no. Me. PT, me. Was it your husband's prescription? PT, no, it was for our horse. Me, it was... Wait, did you say a horse? You took sulfa prescribed for a horse? PT. Well, I only took half me. You only took half because a horse is much larger than a person, PT. Yeah, me. Okay. Were you intentionally trying to hurt yourself? PT. No, of course, not me. But you know you're allergic, right? PT. Yeah, I just have a cold and thought it would help me breathe better, me. So, you took horse sulfa, which you're allergic to because you had a cold and thought it would help your breathing? PT. I took half a horse sulfa, me. Sorry, half. Gotcha. Let's go to the hospital. Story 112. I do cancer research. One of the patients opted to refuse chemotherapy to pursue natural therapies. That natural therapy consisted of urine therapy. Every day they were drinking their urine, but that wasn't even the strangest part. To no surprise, their cancer progressed, and they ended up receiving chemotherapy. Story 113. Ophthalmology surgery tech. Glaucoma patient in her late 50s going blind despite drop therapies for the past 6 months. Pressure is consistently in the 30s and 40s. I ask her if she's using her drops regularly, twice daily, and she says yes. I ask, politely as I can, if she's missed any doses in the past month. She says no. I ask if she's using them properly, and she gets super offended. Asks me very rudely, do I look like an idiot to you? I say no, but I just need to be sure. Sometimes patients think they're doing it right, but they can easily miss. Can you show me how you use your drops? She takes out her drop bottle, gives it a good shake. So far, so good. She looks up at the ceiling, also a good sign, opens her mouth and swallows 2 drops. I got in trouble, but Mayud backed me up and told her that's the stupidest thing he's ever seen in 25 years. She cried and said we were bullying her. And the drops burned her eyes, so she didn't want to put them in there. Since eyes, ears, nose, and throat was all connected, why did it matter where she put them? This is not how glaucoma therapy works. She needed a shunt implant, and we were able to save about 30% of her visual field, but yeah, drinking her drops and going blind. Story 114. Vet nurse here. So it amazes me still how many people think that their dogs and cats are female when they are male and vice versa. It usually starts with an admit. I can clearly see a junk or huge balls. And I look at the chart and it says the animal's name is Chloe, so it goes like this. Me. Is this Chloe or another dog? Oh, no. This is Chloe. We've had her 6 months now, and we're worried about the fact she's lifting her hind leg when she pees. Me. Is she lifting her leg when she walks or moves? Or is it just when peeing? Oh, no. Just peeing. We're actually really worried about her. It's been going on since a couple of weeks after we got her. Me. Well, that's probably because she is Oh, no, she's definitely a girl. Me. No, see this? That's a junk. And see those? They are balls. Oh, blank look. That was an actual conversation I had last week. Owner was not happy. Also, about a month ago, I had a male cat come in for swollen abdomen. Turns out he was a she and she was pregnant. Story 115. This was around the late 1990s in Chicago. Some unfortunate person jumped from a height and obtained crush fractures on his metatarsal and calcaneal heel bones. He was accosted by random people and was running for his life. Since this was at a hospital around a very high crime area, most likely a substances gang related, he walked, limped into the hospital. Side note, I was a resident at the time, and the hospital had several buildings. I had to cross the street for some consults, and if it's dark out, there was a rule that you had to be escorted by security. The Chicago PD regularly had 3 cop cars parked at the hospital. It was Chicago in the 90 AS. Surgery was done with external fixators. The hardware was outside the foot to hold the bones in place and let it heal in a somewhat normal shape. Google external fixators for foot and ankle to see some pics. This person, 1, used a hanger, ruler under the dressing to scratch his skin silly. He had deep abrasions when we changed the dressing. 2, he left the hospital AMA after 2 days. 3, he called the office for pain med refills. 4, he missed his follow-up appointments. 5, he dropped by our outpatient clinic 6 months later to drop off his meticulously cleaned external hardware in a Ziploc bag, pins, screws, etc. We never removed his hardware. I suspect they just loosened and all came off after some time. The human body is amazing. It goes on and can heal despite the crap we put it through. Story 116. I had a patient who had a bullet lodged in her leg. We had the surgeon come and assess her. Based on its placement, he suggested leaving it because removing it could cause even more serious danger. We discharged her. She immediately walked to the ER in the same hospital to complain of leg pain. She had prescriptions and wound supplies in her hand. They brought her back, discovered the bullet wound, and called for a surgical consult. And the exact same surgeon was on call and came to assess her. Guess what? Same suggestion to leave it. We educated her extensively about never getting an MRI or the bullet will fly out of her skin. She returns a few months later at a sister hospital complaining of a headache, admitted inpatient, and you guessed it. They did an MRI. The bullet ripped out and the MRI machine was down for almost a week. Story 117. I've had a crap ton of them, but I think one of my favorites was a patient that came in with chest pain. Dude had 3 prior heart attacks, a pulmonary embolism, and a stroke over the past decade. I started an IV and was trying to draw his blood, but it was just not coming out. It was like syrup. I flushed the line repeatedly and just could not get anything, even though it was a fairly decent size IV, 18G if you know it. While I'm getting his blood, I'm asking about his current symptoms and his history. I ask if he takes blood thinners, and he said he has a prescription, but doesn't take them. When I asked why, he says, I crap you not. I didn't want my blood to get flat, so no ducking wonder he's had clots to all of his major organs. Story 118. A diabetic patient told me that he kept his blood sugar under control by using a type Moss that a Native American had told him about. My interest piqued. I asked him if he blended it with anything or just took it straight. He looked at me, confused, and said that the guy told him to just carry it around in his pocket. I told him there was that it was doing anything, but of course he knew better. He had both legs amputated a couple of years later and pass a year or so after that. Doctors of Reddit, what patient made you go, how the duck are you even alive? Not a doctor, but a witness of a doctor saying this to my grandpa. The guy was not even 40 when he was diagnosed with esophagus cancer, which had spread to his lymph nodes in his neck. He was operated, but was told he would probably never be able to eat solid food again and have difficulty speaking, as the main tumor was located on his larynx. Chemo and radiation was used to treat the spread in his neck, but there was a high chance he wouldn't survive it as the smaller tumors were inoperable. He survived. He learned how to swallow again and regained his speech. All was good. Then he got a stroke within the year. Doctors thought it could be his artery in the neck, damaged from radiation treatment that created a cloth. So as he had just recovered, he was now unilaterally paralyzed by the stroke and again unable to speak or swallow. Years later, he is now able to speak and swallow again, and part of his paralysis is recovered, or he has a way to work around it. Cue to him being 50, cancer strikes again. He now has tumors, which has spread to his balls. They remove most of it, and radiation and chemo do the rest. Now the poor man has no testosterone production anymore, so he is put in artificial testosterone. He is now almost 80, and a few years ago they found multiple dormant tumors, some in his bones, and one in his prostate. They have been treated with chemo and are now under control. He is weak as a stick sometimes, but always recovers. His doctor said to him, the last time he was in the hospital, that he has never seen a person going through so much illnesses and cancers for 40 years, which each one a slim chance of survival, but always recovering. My grandpa, a slightly religious man, said, when the angels are calling, and I think I might finally lose the fight, I turn off my hearing aid so I keep fighting. Story 2. Lady in her mid-30s was in the clinic for a 1-week follow-up post-foot amputation, diabetes. She was admitted straight from the clinic because her blood glucose was 600 milligrams. Normal is 80, 120, and the wound was severely infected. We used super concentrated doses of insulin to bring it back to the 200S. She was on strict diet restrictions, and we couldn't figure out how it wouldn't drop any lower than 250. Turns out her kids, teens, had been sneaking giant 64 ounces sodas and candy bars into the hospital, literally 1 week after we chopped her foot off because of uncontrolled diabetes. Not exactly a case of how the duck did you survive that trauma disease, but how do you even function on your own? Story 3. I work in trauma, and once had a guy fall off a roof. He said he remembered hitting the bars on the scaffolding on the way down. We originally thought he'd fractured his femur, but nope, just a small hematoma. He was in bed next to a man who had broken his ribs and had a small C-spine fracture when he fell forward picking up his keys. Story 4. I was on home call for her in a small town, got a call from the ER nurse one night, and she was like, "Em's brought someone in here and they think she might be dead." I was like, "Well, is she?" She was like, "I don't know." This was a seasoned Ron, by the way. So I was like, "Well, guess we're treating? This is a code blue kind of situation." So without any further information, I jump into my car and rush over to the hospital. Once I got there, I realized why the triage nurse was so confused. In the trauma bay lay what appeared to be remains under a blanket. The person felt warm to touch, so I opened their eye, and a yellow, wrinkled, shrunken eyeball stared at me and then suddenly moved. Potassium of 1. For those familiar with lab values, the backstory was extreme self-neglect, depression combined with caregiver neglect. Weighed in at 67 pounds at a height of about 5 feet 5 inches. We actually resuscitated her, very aggressively and unbelievably. After about 8 liters of fluid, she started speaking a word or two at a time and recognized her daughter. Story 5. As a med student on my emergency rotation, I had a guy brought in who had fallen off a 7th or 8th floor balcony and landed, essentially pass, and we couldn't get a blood pressure when he got to the hospital. As a student, my job was to basically stand to the side and squeeze the bajillion bags of blood that went into this dude. His cervical spine was essentially dust on the initial CT scan we got. I figured he probably wouldn't have made it, but about a month later, I'm now on my ICU rotation and I see this guy awake and conscious. Pretty crazy. Story 6. My blood sugar was 1,000 when I was diagnosed with type 1 diabetes. I was less than a year old. My mom had taken me to the doctor's office 4 times in 3 days, but the nurse called her a nervous mother and sent her home. Also diagnosed with Addison's disease a couple years ago. I'd probably had it for months and had been living on my own in a town where I knew nobody. The day I got home, I basically had a conscious blackout. Happened a few more times over the next couple weeks, and I lost the ability to sense low blood sugars. When I was finally hospitalized, I was in Addisonian crisis. Took them 3 days to bring in an endocrinologist, and he knew what was wrong within minutes. They told me my heart would have stopped within a week due to low sodium, high potassium. Story 7. My dad is 87. He had prostate, liver, bowel, colon, and skin disease. He had lots of reconstructive surgeries. Every year, he has to have at least one skin lesion removed. He had a couple of heart attacks and then a sextuple bypass surgery. He also had a big pneumonia, a huge abscess, and a small stroke. His doctor wants to see him every 6 months. I think just to be amazed that he's still walking around. Story 8. Patient here. When I was 2, I was being treated for asthma due to wheezing, labored breathing, etc. One night it got exceptionally bad, so my mom took me to the ER. They put me face down to do a CT scan. This was 1990. And when they were done, they turned me back over and I was blue, had stopped breathing. Keat revealed a volleyball-sized mass in my chest. Emergency surgery revealed what was supposed to be my twin. It kept growing inside my ribcage and finally had nowhere to go in my toddler body. I made a full recovery. I'm a healthy 31-year-old now. 0 asthma. Story 9. A couple pictures of me before and after brain surgeries were on the front page around this time last year. The mortality rate for acute subdural hematomas is 70%. Of those who live, approximately 30% regain any brain functioning. I also had cranial herniation. My brain tilted 5 millimeters, causing my brainstem to compress into my spinal cord. That I not only lived, but woke up and recovered well enough to go back to work, get married, travel the world. Return to baseline physically is a straight-up medical miracle. I'm still in touch with the neurosurgeon who was on call at the hospital that day, and he says the same thing. Story 10. My mom's a doctor. When my mom was in her ear cycle during internship, a man with police officers behind him came in the ER. The man was perfectly fine and walking, so my mom and her colleagues were confused. The officers showed them a picture of a crumpled metal piece, which was a car. It didn't look like a car at all, just metal trash. The officers told my mom and her colleagues that they rescued the patient from the car, which was lit on fire only a few seconds after they rescued him. The patient didn't have a single scar on him, was perfectly fine. Story 11. Currently in residency, but this was a patient I saw in medical school. This one has more to do with a patient's past medical history instead of anything acute. Had one patient in one of my internal medicine rotations who was admitted for hip surgery, who was one of the nicest, sweetest people I've ever met. Her surgery was pretty routine, and there were no complications. In her past medical history, she was diagnosed with stage IV endometrial cancer that had spread to her brain. Apparently, she had undergone chemo, radiation. She remained cancer-free since that period. The fact that she had undergone that whole ordeal and appeared to be mostly healthy and was in remission from her cancer really blew my mind. Story 12. A guy now passed away who had incurable lung cancer from Agent Orange exposure during infantry service in Vietnam, and his wife had recently passed. Cancer, wife pass. Guy was pretty positive glass half, full about chemo considering the double whammy. Asked him how he managed to keep it on the positive. He said he was returning to base with just days left on his enlistment. Rookie pilot has a mechanical failure of some sort in their Huey. They are going down, and not the controlled kind of landing either. He assumes he is about to die, says everything got real slow, real bright, and a sense of acceptance and peace washed over him. Rookie pulls one out at the last moment, lands their bird with no casualties. Patient told me he felt he should have died that day, and every single day since was a complete gift. Maybe being alive has a lot to do with attitude. Story 13? Obligatory. Not a doctor, but my dad is, and he liked to tell us about the crazy crap he saw. This post made me think of one of those in particular. Huge guy, linebacker build, came into the trauma ward with a wound center of the chest. He could breathe fine, and he had a pulse. So they did a chest x-ray and found that the bullet had spent all its energy getting through this guy's sternum and was just resting on his pericardium. Story 14. My father's doctor couldn't believe A, he didn't need to amputate his feet, and B, he was still alive. Dad had brittle diabetes. His pancreas would kick in and out due to a congenital deformity. At 82, he had significant heart issues, including angina, enlarged heart, and clogged arteries. One day, his feet went black. Not just bluish or gray, black as charcoal. Rushed to emergency. We were told they would amputate, but to say our goodbyes. Dad refused surgery. Said he'd rather be dead at his age. Hours later, his feet were pink. We took him home that morning. Doctor actually apologized for upsetting us, but said he'd never seen anything like it. Story 15. This was many years ago, so I can't recall the exact details, but basically, we had a lady on ventilation with sepsis and multi-organ failure. We counseled the family, and they agreed to withdraw life support, so DNR was issued, and we took her off her ventilator. A few days later, she's still around. Unconscious, but brainstem functions were there. I remember looking at her charts with my registrar, I think resident in the US, and my registrar going, but how? Then one day, maybe about a week on, during visiting hours, the patient's son approached us before he left to thank us for looking after his mother. Story 16. Not the doctor, but the patient. Obligatory. For some backstory, I've always been a fairly tall and lank white boy, and had a pretty bad bout of walking pneumonia at 15. Later on, I had a spontaneous pneumothorax at 18. I was sitting out on the back porch of parents' house, texting my girlfriend at the time, and just generally taking in a nice quiet afternoon in rural Vermont. Duck was it a nice day. My brother came home from a class, union pipe fitter, and asked if I wanted to go somewhere, can't recall. I shot up from the chair and I felt a weird, sharp, almost cold sensation in my left side. I didn't think anything of it, and we made our way downtown. I'd been feeling a stange twinge every now and then from the left side of my chest, but nothing bothersome enough to worry me. After a good few drinks and several hours, we made our way home. As I crawled my ass out of my brother's short-ass sedan, sure enough, I feel that strange sensation in my right side this time. Still not really a clue what it is. Didn't really feel like a big deal. My breathing was a smidge harsh, and my left side hurt a bit from earlier, but I figured I just ducked a muscle somehow. I wake up about 9 hours later. I can barely breathe and hardly move. Every upper body movement is a ducking task. I managed to roll off my bed and crawl out of my room. I'm on the basement floor, first floor for Europeans. I'm gasping for air with every swing of an arm to drag myself closer to and up the stairs where my parents are having breakfast. I get to the top stair and I'm wheezing, shallow breaths because I can barely breathe. I'm damn near sure I'm about to pass. My mom rushes me to the ear and tells the staff at the desk I'm ducking dying, not far off from the truth. I get rushed into radiology to confirm what's going on and to see the extent. Both of my lungs are about 90% collapsed. I don't recall much after walking into the ear. My O2 sats were ducked, and I was already losing consciousness. But I woke up about 12 hours later with 2 tubes in either side of my back, draining the air. I had surgery a day later to remove blebs, skin tags, from the surface of my lungs. Since then, I'm A-okay. Open water and nitrox, certified for diving, avid hiker, whatnot. My thoracic surgeon was ducking, shocked I hadn't died in my sleep given how far gone my lungs were and where my O2 sats were at by the time I got in. Story 17. Patient here, when I was 7, I had horrible asthma. My mom often lied in my bed with me and listened to my breathing. One night she fell asleep and getted awake in the wee hours of the night and found I was not breathing. Goes to the ear immediately because it was only like 10 minutes away. Not sure what happened while there, what tests they did, but I was declared dead. In the morning I woke up, asked who I believe was a nurse where I was, and she started crying and called in my mother, who hadn't slept all night. The doctors said they didn't know how the duck I was still alive, now 16 and haven't had any hospital-worthy complications since. And god damn it, my mom is the most amazing and loving person on this green earth. Story 18. I'm not a doctor, but I meet Mediant, who fell from a 5-stow-5 story ding, landed on his upper back, woke up in the hospital the next morning and got up walking around like nothing ever happened. Barely a scratch on him. Think about it every time I'm in a building with at least 5 stories. Just looking down, like, how in the world did this guy walk away from that like he fell off his bike and took a nap? Actually, I've seen worse injuries from someone falling off a bike. Story 19. Not a doctor, but was the patient. When I was in boot camp, I developed an upper respiratory infection during second phase. Got back and went to sick call where they treated me for a host of things. When they x-rayed my chest, the doctors came out with my films and literally asked, "How are you still alive?" Turned into walking pneumonia at some point. I also had athlete's foot that turned into cellulitis and my last wisdom tooth yanked. So the combination of meds they had me on was enough that I don't even remember that week at all. Story 20. So, not the doctor, but the patient. I had a super bad allergic reaction that was a specific type of allergic reaction that was deadly on its own. It would have been deadly if I had only taken a small bit of the medicine. I was allergic too, but the doctor that prescribed it accidentally prescribed about 10x more than what the maximum dose for that medication is supposed to be. So not only was I super allergic, I was also overdosed on what L was allergic to. So that lead into weeks of me being in the IQ and doctors thinking I had about a 3% chance of surviving at best. Every time I was conscious and had family visiting a doctor, would tell me to make the most of it because I probably wasn't going to make it for their next visit. Eventually, I somehow recovered, but for about 2 years after, I was still regularly going to several doctors to make sure different things were okay that were affected by it. Every single doctor I went to would hug me and would have other doctors and nurses come in and say something like, "Hey, you don't remember this because you were unconscious at the time, but I helped restart your heart." And they were just all amazed that I made it. It's been about 8 years since it all went down. And I've run into several of the doctors and nurses around the city, and they still recognize me and still hug me. It amazes me how in such a large city with such a huge hospital that gets the most extreme medical cases from around the world, that they still remember me being there. Story 21. Obligatory, not a doctor. I'm a funeral director, and I received the body of a 90-something man. I could tell he had been sick for quite some time just by looking at his face. Another funeral director did the embalming, so I hadn't seen the rest of his body. Seeing that he was so old and just looked sick, I was surprised when I met with his daughter, and she inquired about an autopsy. I asked her my usual questions and discovered that this man, for 40 years, had unregulated diabetes. He had a history of strokes, bed sores, deep ones, in and out of the hospital for sepsis, pneumonia, heavy smoker, heavier drinker, suffered a major heart attack just days before. His vision was going, and he couldn't keep himself awake, horrible jaundice, cirrhosis, on and on. I don't think this man lived one healthy day in the last 20 years. I asked the daughter, "So, you want an autopsy?" Because she tells me that her father was not an ill man, and it was not his time to go. She's furious I even questioned her request. I'm baffled that this man lived for 90 years. The denial people can experience in hand with grief is astounding. Story 22. We had one of these at an eye doctor's office of all places. Patient was complaining about how her new glasses weren't working, so the doctor took her in back to check to see if the prescription needed tweaking. The doctor came up with a completely different prescription. Patient was overweight, but claimed she was not diabetic. The doctor convinced her to let us take a blood sugar measurement with a staff member's personal glucose meter. All the meter displayed was high, with some arguing. We were able to get her to go to the local hospital right away. I don't remember what her blood sugar level was, but I remember it was the hospital's high score for a while. She should not have been conscious, let alone functioning normally. Story 23. Not a doctor, but I had a few doctors ask me that. Typically, if you get appendicitis, it'll rupture and sepsis will set in within a day or so. And when that happens, it gets real bad real fast. So I got appendicitis. It freaking hurt so bad, but I didn't know I had appendicitis. I went to the doctor. He couldn't tell what was going on. He thought I had compacted stool and wanted me to take stool softeners. So I did. It didn't help, because, spoiler, it was appendicitis, right? And then a roommate who thinks he knows what he's talking about tells me that it's all in my head, and I just need to physically get off the couch and exercise. Because he feels much better after he exercises. Okay, dude, I can't even get off the couch to use the restroom without almost passing out in pain. He tells me to just play a video game to get my mind off of it. I go to class, grad student at the time. I call the doctor and make another appointment. He doesn't know what's going on. I talk with another doctor, no clue. He thought maybe it's appendicitis, but I didn't have a fever and didn't have a recoil pain. So maybe it was gastrointestinal stuff. So I schedule an appointment, meet with them. All the while I'm going to class and taking the maximum dosage of all pain relievers I can get my hands on. And finally, the good doctor's scans showed that I had appendicitis. Hooray! I go to the nearest ear and I say in a totally calm tone, "Hi, my name is insert name here. So, my doctor said I should probably go to the ER because my appendix burst a while ago and it should probably be taken out or something." Turns out my appendix burst and I held on to it for 3.5 weeks. I had a dozen doctors come in, and some of them even started by saying, "Hello, my name is Dr. Such and Such. And I heard that you're the guy who has had a burst appendix for nearly a month and you're still alive. I am not on your case, but I just wanted to meet you. How are you still alive?" How did you drive yourself here and just waltz into our ear? Story 24. My friend in nursing school was in charge of checking in and out a habitual patient that also was seen by a full nurse and doctor. On checkout, she noticed a bandage on the guy. Oh, that's for me. The guy had an open sore that kept getting bigger and bigger, and he had stuffed 3 t-shirts in it. He had been having repeated health problems, and they just listened to his lungs, would give him an antibiotic and treating him. Story 25. Not a doctor, but my future brother-in-law was definitely one of those cases. When he was about 5 and my fiancé was 10, their family went to go visit their grandparents who own a significant amount of land. Grandparents gifted my fiancé one of those mini 4-wheelers for kids. This thing did a significant amount of speed. I don't recall how fast my fiancé said it would go. And grandparents obviously made a rule that brother-in-law couldn't ride on it alone, and both had to wear helmets at all times. Well, brother-in-law really wanted to ride it and snuck on when nobody was looking and just took the duck off, about 30 feet, before slamming straight into back end of the grandparents' Suburban. From what my fiancé has told me, brother-in-law cannot remember any of this accident. It was bad. Wore headgear for almost a year because he ducked up his head. The doctors told my in-laws that it's amazing he survived and a miracle that he didn't have permanent brain damage. He's a pretty cool kid now at 18 and will be my fiancé's best man. Story 26. Type 1 diabetic in their 20s presented dead of DKA, unresponsive, no pulse, in VF, multiple rounds of CPR, defibrillated, eventually stabilized in ICU, self-discharged immediately after being extubated less than 48 H later. Story 27. I almost passed 3 times. First for illness, second because I had the bright idea to eat an office plant, and third because I managed to fall from the stairs, cutting somehow my left wrist. As a bonus, I could add a 4th time, when I had my sister saving me by catching me from the heels while I was going to fall off a window after my attempt to call the dog outside. I still ask myself how TF I managed to stay alive for 27 years. Story 28. I'm not a doctor, but I do know a story that surprised most doctors. I am currently 19 years old. My childhood was quite normal at first, but everything became quite dark when my grandfather got cancer in his balls. When he started chemotherapies, everything was very hard for him and for the whole family. My cousins and I used to visit him after lessons. A couple of years passed, and our grandfather recovered from cancer. But the smile was erased when they told us that he had metastasis. He had to start chemotherapies again. Luckily, the cancer was not as serious as the previous one, although it sounds strange my grandfather survived, and cured of the second cancer after a year. There were no longer any forecasts of any other terminal illness. At 17, my grandmother passed away, which made our grandfather move with my family, but being quite impatient. He would go out from time to sunbathe and feed the birds. He went to the park by bus. One had done at night, and my grandfather had not come home. He took the bus, but the driver was drunk. The bus crashed, 4 people died and 7 survived, of which my grandfather was. We did not realize that he had disappeared that night. The next morning, we found him in the hospital sitting as if nothing had happened. We all burst into tears as he complained about the decanter while laughing. This year, my grandfather got the flu and we went to the doctor. After writing the medical history, the doctor almost dropped his eyes when he saw that he was still alive. Story 29. Doctor, so many patients, too many to tell. One good one, I once took care of a guy in the rural South who came to the hospital because people said he was growing salt, and he was totally covered in what looked like snow. Uremic frost, I said, since I was fresh out of residency. Guy had been in renal kidney failure for 3 months and had been vomiting every day, which kept his potassium low enough that he didn't pass. But it was still 9.7, and his ECG was a sine wave, and he definitely should have been dead. Google uremic frost. It's a good one. Story 30. I thought I would mention a man I once treated as a patient many years ago when I worked in a small town by the sea. I will call him Mr. M. Mr. M was a small town solicitor. There are not so many of them left in the UK now, but Mr. M and a couple of partners worked in a small solicitor's office, doing the usual round of wills, conveyancing, small-time disputes between neighbors, and so on. Mr. M was middle-aged, very overweight, suffered from a high blood pressure and diabetes, and not a very active man. He was married, and Mrs. M was his opposite, thin, anxious, and a bit overactive. They had a childless, rather unhappy marriage, for reasons not relevant to Mr. M's story. I knew Mr. M's health problems had him marked for an early grave, and that if we could get his weight down, his blood pressure and diabetes, neither of which were well controlled despite everyone's best efforts, would improve. Naturally, I spent a lot of time trying to deal with this issue, with the usual round of advice, referrals to the dietitian, diet sheets, regular weight monitoring sessions, etc. Nothing made any difference at all, despite Mr. M continuing to sadly tell me how hard he was trying and how carefully he stuck to his diet. One day, I think my frustration started to show, and Mr. M seemed rather sadder than usual. I took a new tack and asked him very sternly to take me through what he did and ate on a typical day. We chose the day before. Slowly and reluctantly, this was his story. When he got up in the morning, he would go downstairs for breakfast, made for him by his wife. Breakfast would be 2 rashers of bacon, 2 sausages, 2 fried eggs, a fried tomato, and a slice of fried bread. This he would follow with 2 slices of toast and marmalade, and coffee with cream. Arriving at work, he would have a cup of coffee and 2 or 3 biscuits. After a couple of hours' work, he would walk down to the local baker's to buy a cake or donut for a mid-morning snack. Sometimes, he said, he would be hungry enough to buy 2 cakes or donuts. Around 12:30, exhausted and hungry, he and his partner would walk over to the local pub, where he would drink 2 pints of beer and have lunch. He quite liked the pub's pie and chips, but sometimes he would have steak and chips instead. He would usually follow this with something like apple pie and custard, or chocolate fudge cake with cream. In the afternoon, his snack was usually only a couple of chocolate biscuits. This was all bad enough, but then he told me that on the way home, this would be between 5 and 6 in the evening, he would stop at the local fish and chip shop for a meal of fish and chips with mushy peas. When he got home, his wife would cook him dinner. Usually this was some sort of roast, perhaps roast beef with roast potatoes, veg, gravy, and Yorkshire pudding, followed by a dessert, perhaps apple pie, or maybe trifle. Oh yeah. And they always had a bottle on wine between them. After his wife went to bed, he liked to sit up and watch a film on the TV, accompanied by a liter of Coca-Cola, not diet, of course, and a family bag of some snack or other, or a packet of chocolate biscuits. He took no exercise at all. Remember, this was back in the 1980s. This revocation absolutely stunned me. No wonder this chap's health problems could not be controlled. After I left the area, having made no headway on his problems, I used to run back from time to visit, and occasionally would see him around town, usually in the baker's. How continued to stay alive remained a mystery to me. Story 31. I'd lost a lot of blood to anemia and went into the doctor for something else. She starts looking into my eyes, my gums, pinching my cheeks, and telling me that I'm several anemic, and then said, "Are you always this white and pale?" And then I'm like, "Yeah, I guess." And then she made me take a test. Turns out my blood level hemoglobin was at 6.5 and dropping because of my heavy menstrual cycle and stomach issues not absorbing iron. I'd gone into the doctor because I had really bad heartburn, and turns out that I was really low on blood. It explained all the dizziness, coldness, eating ice by the pound, auditory hallucinations were happening, and I started to just not care about anything. Had numbness in my whole body as well, and trouble breathing. I'd been in such a dire state that I started to accept all of these things as normal. When I checked myself into the air, I told them that my doctor told me to come in, but I think she was overreacting and I can probably just go home. They quickly tested me. My blood level had dropped a little in a couple of days, and I still had heavy menstruation. They quickly admitted me to start my blood transfusion. They said that had I waited, I would have likely gone into cardiac arrest or would have just passed in my sleep. After the blood transfusion, I felt amazing. I could breathe and my skin color was back. Story 32. Not a doctor, but a registered nurse. Last summer, between the months of June to September, we had a young male, 19 years old, who crashed his motorcycle and was sent flying through a van's windshield. By the time he came onto my unit, he had gone through so many operations, and I heard he needed to have over 100 blood transfusions within the first month to keep him alive. He also ended up losing all movement and sensation from the belly button down, as well as losing his left arm. His right arm was intact, but barely functioning. Neurologically, he was with it. Knew his name and that he was at the hospital, but I honestly don't think he knew what happened to him. His family members were very nice, and I could only imagine how they were feeling. I honestly have no idea how he was still alive. He couldn't sit up straight anymore because he would be in terrible pain 24 hours a day. But if we laid him flat, he couldn't really clear his secretions. I'm surprised he didn't get pneumonia or aspirated or something else. We discharged him to a long-term acute care facility, and that's the last I heard of him. But it's just such a sad story considering he's only 19.